Good morning everyone. Myself Dr. Kirti, Assistant Professor of Physiotherapy Department. Today we'll discuss about ultraviolet radiations. So basically ultraviolet radiations are electromagnetic radiations which are invisible to human eye with wavelength between 400 to 100 nanometer, and it lies between visible and X-rays in electromagnetic spectrum. So they behave in same way to visible radiations in the way they are reflected, refracted, absorbed, except they are more strongly absorbed in air, in particular the short wavelength ultraviolet. So classification is UVA, UVB and UVC. UVC is germicidal UV and short, and UVB is abiotic and medium, UVA is biotic and long. Then production of ultraviolet radiations. We are having the mercury vapor lamp, which is a, we can say, gas discharge lamp which uses electric arc to vaporize mercury to produce the light. And all these lamps, including the metal halide lamps, contain a feature which prevent this ultraviolet radiation from escaping, and usually the borosilicate glass outer bulb of lamp performs this function. What is its advantages? It is safe, easy to control the output, arc intensity is small, there is no need to do the warm up the lamp. Then fluorescent tubes, which are low pressure mercury discharge tube with phosphor coating on inside, and the layer absorbs the UVR, notably the spectral line f to 54 nanometer, which causes the excitation of the phosphor atoms and re-emission at the longer wavelength, that is fluorescence. And the output of these lamps also vary with the temperature. Tubes used in physiotherapy are identical in shape and size, but they are having the special phosphor coating in the tube, which makes it continuous spectrum between 250 to 280 nanometer and 382 nanometer to lines in blue and green visible, which gives the considerable UVA, UVB output but not UVC. So for whole body treatment, long fluorescent tubes can be mounted on semi-cylindrical tunnel bed or canoe arrangements configuration for local treatment, and it gives low irradiance and is blind to uneven skin exposure, especially at side of the trunk. And same type of tube is used to produce large UVA for the treatment in psoriasis in conjunction with psoralen sensitized UVA treatment. There is also a chrome air lamp, medium pressure mercury vapor ultraviolet lamp, which which is designed to use in contact with tissue or skin surface and body. What are its physiological effects of UVA? Erythema, reddening after application, and edema and irritation of skin if there is application of UV sufficiently intense, and there is peeling of epidermis. If the same dose is repeated after these changes have recovered, it provokes a less stroke reaction due to protective pigmentation, skin thickening mechanism lasts for 24 days. There is erythema due to release of histamine, prostacyclin, epidermis, superficial dermis, and pigmentation due to melanin formation in the deep region of epidermis and migration of melanin already formed into a more superficial layer. So this process takes time, usually noticeable after 2 days. Pigmentation is strongly stimulated by erythema. Then we are having the thickening of epidermis. There is a stimulation of UVR, which provokes the increased keratinoid cell. So both these protective effect, pigmentation and thickening, last over 4 to 6 weeks after stopping the UVR exposure. Then peeling of epidermis. There is increased thickening of epidermis is lost as peeling. When this happens, the resistance of UV to skin is lower. Then there is also solar elastosis and aging. There is thinning of epidermis, there is loss of epidermis, loss of melanocytes, dryness. There is poor functioning of sebaceous sweat glands and wrinkling also. It is having the antibiotic effect. There is production of vitamin D, and also it is having effect on DNA. So it can prolonged use should be avoided. In case of psoriasis, acne, eczema, vitiligo, for vitamin D deficiency, mild hypertension, pruritus, and chronically infected open areas, and contraindicated if there is hypersensitivity to light, deep X-ray therapy or herpes simplex or SLE. There is erythema and recently skin grafting. Thank you.